Overcome leg pain and unwanted veins with the latest technology.
Rosen Vein Care offers minimally invasive procedures targeting varicose and spider veins. Take a look. Dr. Rosen, thanks so much for being with us today.
Thanks very much for having me.
Okay, let's start with the basics. What are varicose veins?
Varicose veins are the veins that bulge from the surface in some people's legs.
Okay, and what causes them?
Well, before I can explain what causes them, I'm going to explain how the veins work in your legs in general. So veins, really wherever they are in the body, their whole purpose is to return flow back to your heart. But the leg veins have it a little bit harder because they have to fight against gravity in order to send the flow back up and keep it going up in one direction. And so how they do that is by having these special check valves inside the veins. And they open to let the flow go back up towards the heart. And when gravity's trying to take it back down towards their ankles, they have to snap shut very quickly. But those check valves can break in some people more than others. And when they do, that can allow flow to move the wrong way down the legs and start building up pressure over the course of the day and over the course of years. And the more that pressure builds up, the more it can stretch out veins. And so the superficial system of veins in your legs is set up like a tree. There are trunks, and then there are branches that connect to the surface. And so it oftentimes will start in the trunk veins, and the pressure eventually can affect the branches that lead to the surface and stretch those out as well. And once the branches get stretched out, they can bulge from the surface and become much more noticeable.
So that's when we start to see the vein bulging out of your leg. And then how do you know if it's...
And some people.
Like, am I seeing it?
I'm at work, I got the jacket on.
But how do you know if it's at the point where, like, you need to do something about it?
So some people feel that they need to do something about it even before they notice things at the surface. And really, it's really important for me to reach those people as well, because even before you might see things at the surface, you might notice things like heavy legs or tired legs or leg cramps or chronic itching in your legs that you can't explain, or swelling. And these symptoms happen more so at the end of the day rather than at the beginning of the day. And so those people, if they come in, they're being a little bit more proactive than the people who have some of those symptoms and then start noticing the things at the surface over time.
Okay, so you've described common symptoms. Can you tell us who's at risk for varicose veins?
Yeah, both men and women are, but certain people are more at risk than others. So genetics is a big factor.
Okay.
So if one of your parents, it's actually the perfect problem. So you can point the fingers at everybody else except you. So it's either your parents or your kids. So,
oh, really?
So genetics is a big factor involved in this. If you have one parent who's had vein issues, then you have about a 50-50 chance of getting it. And if it's both parents, it could be about up to 90% chance of you getting it. But in terms of differences between women and men, the reason why women will get this more commonly is because of pregnancies. So with each successive pregnancy, there are factors involved that make it more likely for varicose veins or for those check valves to fail and then varicose veins to happen as well.
Interesting. Okay, so then if you do have varicose veins or spider veins, how is that treated?
Yeah, nowadays it's treated very easily and very safely and very effectively and very conveniently. I do everything in my office. There's no reason for anybody to be in the hospital for any of these procedures. These are procedures that you can drive yourself to and from my visits. The actual time that I'm spending with patients and taking care of people is about 10 minutes.
What?
For most things. Yeah. And
wow.
So, indeed. And then there's no downtime. So you can go right back into doing most of the activities you normally do.
And it's not painful? You said no downtime?
There's no downtime. The strongest thing that anybody needs for discomfort afterwards is over-the-counter Aleve or ibuprofen, Naproxen, those kind of over-the-counter things. And most people only need it for the first couple days. And a lot of my patients will tell me when they come back and see me for their follow-up visit, they didn't even take any. So
really?
It depends on people's pain threshold, obviously, but I've never had to write for anything stronger than just those over-the-counter medications afterwards.
Okay, well, sign us up. Okay, but tell us, will insurance cover this too?
It depends what you have. So when people come in for their initial visit with me, if it's warranted, we'll do an ultrasound examination to look for those issues that might be going on in those trunk veins beneath the surface. If we find things going on in in those trunk veins, then oftentimes, yes, most insurance carriers, including Medicare, will cover many of the procedures that I do. There are a few procedures that are the staples of the things that I do. One, and neither of them are surgical. You don't need to do surgery for any of these things any longer. One of them is endovenous laser ablation, which is one of the modalities of treatment that I have, which is using just some local anesthetic and using a very small laser inside the vein to heat seal that vein segment shut. That's how we take care of trunk vein segments primarily. And then for treating the branches that connect to the surface, again, I don't have to surgically remove any of those branches. That would be a procedure called phlebectomy. But nowadays, again, I can handle virtually everything that I needed to in branches closer to the surface with just by doing injections. And that procedure is called sclerotherapy.
Is it mostly people that find that the varicose veins are doing something to impede their functioning, or is it cosmetic too?
It's both.
It's both.
It's both. I mean, like I said, that whole slew of symptoms that people can have, that can be a limiting factor. So a lot of my patients will say that they can't do some of the activities that they normally would love to do, whether it's exercise or, honestly, a lot of patients who have jobs where they have to either sit for long periods of time or stand for long periods of time at their job. So things like, like bank tellers, teachers, hairstylists, and others who stand mostly in place for long periods of time, they have a hard time doing that. And so and in addition to that, people want their legs to look great.
Yeah.
And so it's a combination for most of the patients.
Well, thank you for all the information. We really appreciate it.
That's what I'm here for.
You can find Rosen Vein Care in Hinsdale, Deer Park, and now in their brand new facility in Northbrook. To schedule a consultation with Dr. Rosen, just call the number you see there on your screen, or you can also scan that QR code or head to rosenveincare.com.